And the next presentation is on community engagement to reduce neurotrauma in South Africa. This is very important to engage the community, to engage the parents and the population. And we're going to be learning from the South African experience, which will be presented to us by no other than Miss Devin van Laar, sorry. Ms. Devin is a great community researcher, a great project coordinator for the University of Cape Town and for the NIHR Global Health Research Group of Acquired Spinal and Brain Injury. She's acquired great experience in community engagement research, and she focused more on pediatric brain injury and neurotrauma prevention. And she has great experience in coordinating research, data management, and how to translate this research into impactful community intervention. So we are pleased to have Ms. Devin van Laar. Hi, Ms. Devin. Hello, Ms. Devin. Can you hear me? Hello, Ms. Devin. Can you hear me?
Yes, I can hear you. Can you hear me?
Great.
It's all working now.
Yeah, it's good now.
Great, thank you. Good afternoon, everyone. Thank you so much for the opportunity to present. My name is Devin van Laar, and I'm the research coordinator in the Division of Pediatric Neurosurgery at the University of Cape Town, and I work within the African Brainchild Research Group. And today I'll be sharing with you how our team used community engagement to shape our research priorities and to guide us on our mission to reduce neurotrauma in children in South Africa. So road traffic accidents are the leading cause of death in healthy children in South Africa. And children are the most vulnerable population when it comes to head injuries. They have developing brains and smaller bodies and are far more likely to experience long-term consequences after a traumatic brain injury. At our hospital, we see some 2,000 children with head injuries every year. Our research showed that road traffic accidents are responsible for almost 80% of the severe head injuries in our hospital. And of this patient group, only 4% were wearing seatbelts. Very few people are being quick to click, and we see those consequences far beyond the hospital. Globally, around 55 million people live with disabilities from traumatic brain injury. Children are especially vulnerable because their brains are still developing and the brain's own protective mechanism aren't fully matured. The younger a child is when the injury occurs, the longer and more far-reaching the consequences can be over their lifetime. There's a strong association between childhood TBI and later behavioral difficulties, learning challenges, and even an increased representation of TBI survivors in prison. These are lifelong injuries, and this is not only a clinical and developmental concern, it's a societal one, which highlights the profound long-term societal impact of neurotrauma and strengthens the argument for prevention. Prevention is key. We know from WHO data that the use of seatbelts reduces the risk of injury by 40 to 50% in the front of a car and by 25% in the back. Child restraints especially can reduce the risk of death by up to 60% because in the event of an accident, an unrestrained child becomes a projectile. Even at a low speed, the force exceeds what the human body, especially a child's body, can tolerate. Yet from our research at the hospital, it showed that 96% of the children weren't wearing seatbelts, which is a systemic failure in road safety protection for our children. So how do we prevent these injuries before they reach neurosurgery? There's an African proverb that it takes a village to raise a child. Well, we say it takes a village to protect a child. Preventing neurotrauma is not something clinicians can do alone. It requires contribution from parents, teachers, healthcare workers, government, NGOs, people with lived experience. So we saw the clear opportunity for prevention through our community awareness Be Quick to Click campaign, which we launched in 2023. Our first step of the Be Quick to Click campaign was media and awareness in collaboration with ChildSafe. So ChildSafe is a national child injury prevention organization based at our hospital. And together we highlighted the core idea that being quick to click can save lives. We reached over 43 million people through radio, TV, and print, generating more than 3.6 in earned media, which gave us a powerful foundation for public recognition and engagement. But community feedback highlighted the critical barrier of car seat accessibility. Parents wanted to secure their children, but they just couldn't afford car seats, which led us to our next step, access. In order to address the access barrier, we partnered with Wheelwell. Wheelwell is a non-profit, community-focused NGO that specializes exclusively in car seat safety, particularly for children in low-income households, along with Superquick, a national automotive company, to co-design a large-scale car seat handout that Hutch mentioned earlier. So through this collaboration, we got 100 new car seats donated by Superquick and over 265 second-hand car seats, all of which were cleaned and inspected. It was a fun day, but a very important day. Parents didn't only receive a free car seat, they received education and training on how to correctly use the car seat. And I'd like to share with you a video of the day.
We are at Superquick in Plumstead for this fantastic event in partnership between the African Brainchild Research Initiative at the University of Cape Town, Wheelwell and Superquick. We've had an incredible campaign trying to raise awareness amongst our community about the importance of children wearing seatbelts and being appropriately restrained in age-appropriate car seats.
Car seats are specifically designed to reduce traumatic brain injury, and this is where we have common ground with African Brainchild and their Be Quick to Click campaign. Traumatic brain injury is a severe injury to a child's head, and it has a lasting impact on their quality of life.
I'm incredibly satisfied with the outcome of today. But ultimately, what this comes down to is making a real difference in our society, like parents all over the country. They just want to do the right thing by their child. It's our responsibility to show them the way to do that and help them provide the resources to do exactly that, to look after their child in the way that they would want to.
Car seats are absolutely essential in preventing traumatic brain injuries as a result of car accidents. This is one of the major causes of death and disability in South African children. And so this campaign, together with other campaigns run by incredible organizations like Wheelwell, Superquick, Child Safe, Arrive Alive, and others, are absolutely essential. By keeping them safe, we are preserving the future of South Africa.
Thank you all for watching. So at this event, as you can see on the video, we had a lot of engagement and experience with our communities, and we witnessed firsthand the challenges that parents face in keeping their children safe on the road. So many parents shared that they wanted to use car seats and they simply couldn't afford them. Others were unsure about the rules or felt that the laws weren't so strictly adhered to, and the risk didn't always feel immediate. So these are the surveys that we did with the parents at the event day. We, of course, saw that the high cost of the car seat was one of the major barriers to car seat use, but there was also a lack of education and awareness around the importance of car seat safety. We asked the parents what would help them use the car seats more regularly in the future, and again, cost came up, but the awareness and education was definitely a gap that we could try and fill. There was also misconceptions that came up in the conversations with the parents. Some parents came to get a child car seat for their infant and didn't realize that they also needed a car seat for their toddler. So we could see that there was an increase in the availability of the car seats that we provided with the campaign, but there was still a lack of understanding in the importance or which car seats were appropriate for different ages of children. So these insights stimulated us to integrate road safety into our annual Brain Awareness Week community engagement initiative, where our education could have greater long-term impact. For Brain Awareness Week, we worked together with Yabonga, a community-based organization, to bring children from under-resourced schools into an interactive day of learning about the brain. So during Brain Awareness Week 2025, which was themed Hands on the Brain, Eyes on the Future, we engaged with over 100 children from under-resourced schools. They learned basic neuroanatomy, how injuries occur, why seatbelts matter, and the forces involved in the collision. The QR code on the screen will take you to another video we have on YouTube about Brain Awareness Day. And when we interacted with the kids again, we saw that there was a 45% increase in their knowledge of the brain before and after our event. We also saw that there was a drastic increase in their interest in becoming a scientist in the future. Another stakeholder that we chatted to during Brain Awareness Week was the teachers. Teachers who we know are knowledge multipliers, and they acknowledged their own learning because they weren't sure of the road safety protocols and requested that road safety be embedded in their school curriculum. So we know that awareness and education are important, but we also need a way for children and adults to experience the forces involved in a crash. People often need to see and feel risk because facts alone don't change behavior. So along with the Cape Town Science Centre, we co-developed the Seatbelt Convincer, a crash simulator which physically demonstrates the protective effects of a restraint. This is an incredibly powerful tool, one that we hope will help children immediately understand the force and effect of wearing a seatbelt, help parents see why holding their child is not enough, and we hope that the Seatbelt Convincer will be mobile, scalable, and accessible to schools and communities. We plan to launch it during Brain Awareness Week next year and invite policymakers, members of government to see how we can introduce that into education and policy. So this is our intervention path so far. Each step has emerged in response to what communities told us they needed most. And it reinforces a central point that effective neurotrauma prevention is multi-layered. And despite all this work, the truth is that the reality is really complex. Buckling up is influenced by the cost of safety, by transport issues, by cultural practice, by the law enforcement gaps, by unsafe secondhand car seats, shared vehicles, parental beliefs, and a lack of education, which brings us back to the village. The work cannot succeed without a multi-armed, community-informed approach, which is why we have formed our Community Advisory Board, consisting of parents who make daily travel decisions, teachers who shape children's understanding, healthcare workers who see the consequences, hopefully members of government who create enabling policies, NGOs who support communities, and people with lived experience who bring insight. And of course, we need the wider public to influence our social norms. We hope our board will guide research priorities, our community engagement strategies, and implement pathways. Our goal is not to impose solutions, but rather to co-design solutions with the people whose lives they affect. And of course, I'd like to say thank you for the ABSI team who's put all the work and effort into all of our community engagement initiatives, especially to Prof. Ursula Rolving, who's been the driver of CEI since 2019 when she first launched her first Brain Awareness Week. And in closing, our work has shown that reducing neurotrauma is not a single intervention. It's a sequence shaped continually by community insight. Awareness to reach families, access to ensure equity, education to empower children, experience to shift behavior, and partnership to sustain change. Children deserve safety in every seat, in every vehicle, in every community. Thank you.